If you have not participated before, my name is Rachel. I'll be helping Dr. Trego here in hosting this webinar. At any time, if you have a question, there is a chat feature at the bottom of your screen, as well as a Q&A section. So feel free to ask a question at any point. We will answer them at the end of the webinar. And I will just go ahead and introduce Dr. Trego here, and we will get started. So Dr. Trego is one of the optometrists here at Nittany Eye Associates. He joined the practice in 2007. Prior to that, he practiced in Philadelphia, where he was mentored by Dr. Scott Edmonds, who is the chairman of the Rothman Institute Concussion Network. This experience has led Dr. Trego more recently to focus part of his practice here in State College on helping patients who are recovering from concussion and traumatic brain injury. And he will be discussing more about that in today's webinar. So go ahead and take it over, Dr. Trego.
All right. Thanks, Rachel. And thank you for moderating this webinar. Thanks, everybody, for attending. As Rachel mentioned, my name is Matt Trego, and one of the optometrists here at Nittany Eye Associates. And that 2007 number is kind of scary. I can remember when I was the new young eye doctor in our practice, and that was many new young eye doctors ago. So I'm getting old. Anyway, so yeah, today's discussion is a little bit about some of the newer tools that we have available to us to help patients through symptoms that they may be experiencing after a concussion or traumatic brain injury. So some of the effects the concussion can have on our eyes and some of the newer tools we have here we'll get into in a bit, but let's start at the beginning here with just a general definition of concussion, which is type of traumatic brain injury. It can be caused by various types of injuries, whether from an obvious hit or bump to the head, a blow, a whiplash type injury from a car accident, or a blast from an explosion. When this occurs, the soft tissue of the brain ricochets off of the bony structures of the skull, and this temporarily damages some of the cells in the brain, which causes chemical changes in the tissue and makes it more difficult for them to function. I like to think of this as sort of a scrambling or a jumbling effect on this tissue. And these cells of that make up the brain and the nerves that feed the different parts of our body have trouble carrying out their usual function when in that scrambled state. Here again, we'll kind of gloss over this, which would be the types of injuries. It's interesting there to point out at the bottom of this slide that there may or may not be loss of consciousness from the injury, but usually when we see patients who have suffered concussions, their radiologic studies like MRI and CT come back normal, but they're left with some functional deficits. So here on this slide, we see a few statistics. So I can say for sure, from an incidence standpoint and awareness standpoint, that as a clinical entity, concussion today is light years ahead of sort of the awareness of concussion when I was growing up, and I'm sure in generations prior. As a former athlete and a current sports junkie, I'm well aware of the pervasive awareness of concussion in organized sports nowadays. You can barely watch a football game on a weekend without being presented with the term, with the concept. And for anybody in the audience here who has experience with coaching youth sports, like me, you may have taken an online concussion awareness certification program just to teach something as simple as, or to coach something as simple as youth basketball or pee-wee baseball to elementary school students. So the awareness is definitely there. And that's important because this can have far-reaching effects on function if concussions occur and are not picked up. So despite all this encouraging these trends towards more awareness, many concussions definitely still are going undiagnosed, and there are a lot of reasons for that. Obviously, chief among them would be athletes, fearing removal from games that they want to participate in, coaches potentially putting winning ahead of their athlete's safety, although I think we see less of that today. It's by no means an extinct practice. And also the variability in response to injury from athlete to athlete. No two concussions are the same. No two athletes who suffer them are the same. And we can see wide ranges in responses to these injuries. According to the AOA, 1/3 of all youth and adult athletes may have sustained at least one concussion that went undiagnosed during their playing careers. So when concussions go undiagnosed, they can obviously impair the athlete, both from a physical standpoint and a mental standpoint. And this leads to potentially susceptibility to further injuries down the road. If you're noticing a theme here with our previous slides with the Clemson Tigers quarterback Trevor Lawrence, many of you may know Avery Simber, Dr. Mike Simber's daughter is currently a student at Clemson, and so therefore the whole Simber family are rabid Clemson fans. So this is a little cap tip to the Simbers, go Tigers. So some concussions, especially those that don't occur on the field or a motor vehicle accident or an explosion type thing, some concussions can come from what we might think of as a pretty innocuous injury, like bumping one's head on an overhanging cabinet or a door or something like that. Those, I think, actually, I'd like to emphasize this point. Those may, in some cases, be more likely to lead to chronic long-term dysfunction because patients may be more apt to just sort of brush them off, maybe not give them their full credence, and assume that the symptoms that they lead to are just somehow part of their new normal, or may not even associate them with the injury. This slide lists several of the types of most common symptoms that we see with concussion. They're wide-ranging. Our patients who suffer concussions will often describe just feeling like they're in a fog. We hear that term an awful lot. As you can tell, if you're experiencing some or many of these symptoms, it would be pretty difficult to function normally. And chief among them at the bottom of the list in all caps is vision problems, which is one of our big focuses here. So it may be in upwards of 90% of concussion sufferers that the vision is the chief complaint in some degree, whether it's double vision, visual fatigue, light sensitivity, glare, difficulty fixating, reading because of tracking difficulties, depth perception. It's interesting, I think, on this list that you don't see blurred vision as a bullet point, and that's kind of by design, because although we may hear blurred vision sometimes with these patients, blur, if the eyeball itself or eyeballs themselves are intact, and with most head injuries they are, although there are some exceptions with retinal detachments and things like this sort from trauma. But for the majority of our concussion patients, their eyeballs are intact and healthy. And again, as we discussed, their radiologic studies like MRI or CT may also be normal. And so there could be some trend towards pushing the patient back to work or to school or to sports when there's still something that's not right with their visual system, and it can be difficult for the patients to enunciate exactly what. So, you know, you've heard this cheesy saying that the eyes are the window to the soul. So in our case, it really may be more appropriate to say they're the window to the brain, because such a high percentage of traumatic brain injury patients experience some constellation of these visual symptoms listed here. So following a concussion or traumatic brain injury, once it's been established that the patient's been cleared of any life-threatening diagnoses like a skull fracture or a bleed on the brain, once these things have been ruled out, the primary treatment is rest, both physical rest and mental rest. And we highlighted here, especially computer and electronic devices in our world, you know, in our COVID quarantine world, we're obviously all seeing just how dependent our modern lives are on devices and technology. And this can sometimes be difficult to get concussion sufferers to put those devices down to rest and heal, but it's really important that they do. Thankfully, somewhere around 70 to 80% of patients recovering from concussion recover fully in approximately 2 to 4 weeks, and they can resume their normal routine. But if their symptoms persist past this point, or if their symptoms recur after attempting to resume activity, then they may be diagnosed with PCS or post-concussion syndrome. And it's at this point that it would be likely that they would arrive in our office for further evaluation. This can sometimes also be associated with attempting to be cleared to return to play protocols. So when they arrive for an evaluation with us, we're going to perform an extremely thorough examination, which is going to include many of the tests that you might already be familiar with from your annual eye exams, as well as several others that are concussion specific. Two of these tests in particular we wanted to highlight today are the last two on this list, the VEP and the right eye. And before discussing those specifically, I did want to point out that it's not uncommon for this concussion evaluation to reveal other eye issues that might be making it difficult for patients to function, and that perhaps were present prior to and or unrelated to their injury. I just wanted to mention that the red herring phenomenon is, you know, real in this case, where we'll, you know, be careful to look for other pathology as well. So this test, the VEP, which is made by a company called Diopsis, is a little bit of a strange looking test. Many of you are, of course, familiar with visual field tests that you undergo in your eye doctor's offices. And that test measures the health of different parts of the visual pathway from the eyeball to optic nerve back to the brain. But as you may be painfully aware, those visual field tests require you to click a button each time you see a stimulus. This VEP test does not require that. The patient simply looks at the VEP display, which is a series of alternating light and dark gratings on a screen. And the instrument records the activity in her visual cortex, the part of the brain, posterior part of the brain where your vision is processed. It's painless. It's very simple to take and administer, and it can be useful in assessing both the severity of the brain injury and in monitoring their improvement throughout therapy. The right eye is the other newer instrument that I wanted to highlight here today. It's a computer-based test that digitally tracks the patient's eye movements while he or she is following some very simple instructions on a computer display. And it gives us a quantitative analysis of how the patient's eyes track moving targets. Those would be called pursuits. How their eyes jump from stationary target to target, like word to word when reading, as well as how they maintain fixation on a fixed target. Some or all of these could be diminished following concussion, and we have assessed these tests in a more rudimentary way for years in our offices, but prior to this, right eye technology did not have a way of quantifying the results. And what's really interesting about the right eye is it gives a very detailed result sheet and score, and then can be re-administered. It takes 5 minutes, it's very simple, but can be re-administered through therapy as the patients progress towards recovery. The right eye can also indicate for us some additional therapeutic exercises that can help the patients towards recovery. All right, so this page shows a list of several approaches that can be considered for avenues to help recovery. As you can see, they can include things like lenses, both to correct potentially pre-existing refractive disorders that are compounding problems, glasses to help patients focus at near, prisms, which can additionally help with vergence difficulties. Patients will often have trouble converging or diverging their eyes to maintain single vision after an injury like this. Filters and tints can be incorporated in lenses to help with light sensitivity. Certain wavelengths or colors of light can be much more difficult for patients to tolerate following brain injury than before, and those can be, in some cases, life-altering after the patients are identified, after the tints are identified that are useful. And I highlighted Recharge here, which is our sort of our preferred blue light blocking lens that we use at Nittany Eye Associates. And patients following traumatic brain injury will be, in many cases, highly sensitive to strain from devices. Blocking blue light from getting through their lenses can help to diminish this sensitivity. Occlusion refers to the possibility that the patient has difficulty moving their eyes into a specific field of view, and this is creating severe double vision. It is, in some cases, useful to temporarily block off or occlude that part of their vision with a simple adjustment on their lens, a frosted or taped section. Free space vision therapy is not a new concept, but it is still a very useful one. Many different types of exercises can be done, not at a screen, but either at a desk or in free space to help rehabilitate some of the nerve muscle connections that are diminished at first. Computer-based vision therapy is sort of a newer arm of that concept, and with the right eye, some of these exercises are automatically recommended based on the patient's results. And then finally, I highlighted the role of supplements. There have been numerous studies that suggest a omega-3 fatty acid supplementation. Nittany is a high potency omega-3 fish oil that we prescribe in our practice that has been shown to improve patients' recovery time. So to summarize here, our role as optometrists in the picture, there are a couple points I want to emphasize. Number one is a really thorough history when you see us. And this can include people who are not referred for concussion evaluation specifically for routine eye examinations. Our technicians would be asking patients if they've ever had concussion or traumatic brain injury. And if so, if any of their persistent complaints might point to a relationship from that. So anyone who has a known concussion history will be very interested to hear if any of these eye muscle or eye focusing disorders might be present without the patients really being aware of it, or with them attributing them to other things just like age, or this is just the way my eyes have become over time. And I think you can obviously get the gist of these last slides before this, that these new technologies, we're excited to be actively incorporating them, both in diagnosing the effects of concussion and helping people improve their function and get back to normal. And that helps us work with other allied health providers, from primary care doctors, sports medicine doctors, physical therapists, vestibular therapists, etc. And lastly, Trevor Lawrence, wittingly or unwittingly, he got lumped in with this internet celebrity who everybody discovered looks just like him. So at this point, Rachel, you have any questions for me?
Yeah, we do have a couple. Actually, we'll go ahead and get started here. Is the VEP and right eye test covered under most insurances?
Yep, it's a great question. So, yep, we submit those as medical tests to the patient's medical insurance. As Rachel could tell you, a lot of times there's confusion between patients who we see in our offices. I have vision insurance and I have medical insurance. These would be tests that are submitted to your major medical insurance, and they are by and large covered.
Thank you for that. And we have one more question here. If anyone else has questions, now's the time to send them in, but we'll go ahead and ask this next one. Are there any new treatments for people with permanent visual field loss?
Permanent visual field loss is a really difficult one, especially in cases where stroke or ischemia is the source. There's some hope for improvement in lost visual field generally within the first 6 months. So if you've been told that you have permanent visual field loss, but that was, the recent statement, I would say, in my experience, 6 months is kind of the window. If it doesn't seem to improve or come back, it's unlikely to. Unfortunately, we're talking about central nervous system tissue that is permanently damaged. So regenerating nerve tissue would be necessary to restore permanent visual field loss. Something that is certainly being studied, I would group that in the stem cell therapy, holds some promise with that. But as of right now, I'm not aware of any cures that are imminently on the horizon.
All right.
That said, I would point out one thing on that, Rachel. One of the bullet points on a screen was prism, and prism actually can be used in lenses to increase patients' peripheral awareness of areas that they may be missing in their peripheral vision due to neurologic disease like stroke or like an injury. So, that doesn't cure, but it can help patients function better in spite of.
Thank you for that. All right. We have a few more here, so we'll work through these. In MGD, do glands regenerate after they have been atrophied or truncated?
So meibomian gland dysfunction. Glands do not regenerate fully if they are stimulated with some of our newer in-office therapies that are sort of improvements upon the old tried and true warm compresses that patients can do at home. You can see some improvement in function. But of course, this is tissue that's aging. I would lump it into, a lot of the other tissue in our body, skin and hair, a lot of the, connective tissue that we're made up of atrophies somewhat from age with time. So I think there's promise to somewhat stem that tide with direct stimulation like MIBO, et cetera, but I wouldn't say that there's full regeneration.
Okay, and can these tests be done at all Nittany Eye offices?
Great question. So currently, we have 5 offices, and the 2 that are located in State College, so Windmere Drive and Grays Woods, have the capability to perform VEPs. And currently we have 1 right eye instrument, which is somewhat portable. So depending on the need of the patient, it's possible that we could rotate the device to other offices. I would say in the short term, if you are typically a patient of a branch office, it's more likely that we would see you for these tests at primarily the Grays Woods or Windmere Drive office in the short term.
If someone had many of these symptoms after a concussion, but most have improved over time, in this case about a year, should an examination still be done?
Well, you're going to know my answer, right? I mean, absolutely. I think if the concussion is that far out, it's possible that some of our patients, maybe not this questioner, but some of our patients might be psychologically already, have moved past the concussion. I think it's really important to mention when scheduling that you had a concussion and that you are still having some symptoms. You think you're largely over it. I think it would be important to potentially probe, all of the things that we talked about in the list of items, and there may be something that could get a patient over the hump, so to speak, if they are still having some persistent symptoms. I really would just, emphasize the when scheduling, to be explicit that, if you're requesting for yourself or for a loved one an evaluation because of concussion, be sure to mention that in scheduling. And if not, if you are at your next routine exam, if it occurs to you that, oh yeah, I did have a pretty significant head trauma X number of years ago, bring it up. I think that is we see perhaps an underserved little chunk of our patients who we don't want to miss something we could help them with.
If you do want more information on that, please give us a call. Our phone number is listed on our website. It's nittany.com, and we are more than happy to answer any questions, or you can send them directly to us at marketing@nittany.com. That's our email, and we will answer those questions for you. But thank you so much, Dr. Trego, for this presentation, and thank you everyone for joining us today.
Thanks everyone. Thanks, Rachel.